Hi there, this is Dr. Khraizat, and today I'm going to talk to you about how we help patients recover and get back to normal life sooner after undergoing surgery, whether it's gynecological or obstetrical surgery. In our practice, we encourage the following to help patients recover quicker and with a smoother course to recovery by following such guidelines. First, it starts in the preoperative stage, and that's when we partner with the patient to educate them about what's going to happen during surgery, what the indications are for surgery, what the risks and benefits are, what the expectations are. We also advocate for preoperative cleansing of the surgical area at home the day before, and nothing to eat for about 6 hours before the start of surgery, and nothing to drink for 2 hours before the start of surgery. And what you drink up to 2 hours before surgery should be something that you can read a newspaper through, so something that is a clear liquid, period. In terms of in the hospital, we give appropriate preoperative medications to help decrease the risk of infection. So we give preoperative prophylactic antibiotics for most cases when it's indicated. We also give anti-nausea medications, including a patch behind the ear and potentially some steroids or anti-nausea medication to help decrease the risk of nausea intra and post-operatively. In terms of pain, we try to preempt the pain preoperatively as well by offering the appropriate patient an epidural if it's an open incision, or preoperative and anti-pain medications to help decrease the risk of pain in the immediate post-operative period. We do offer TAP block, which is a block of the nerves that run across the abdominal wall, and that's done under ultrasound guidance, usually by the anesthesiologist, to help decrease the risk of pain significantly after surgery. In the immediate post-operative period, we give antibiotics for about 24 hours to further decrease the risk of infection. We also utilize multimodal analgesia, which means we try to minimize the amount of opioids that the patient uses by giving multimodal analgesia, and that includes medications of different classes that not necessarily are not narcotics, and together in the appropriate doses help the patient to minimize narcotic use and opiate use, so that she may have less risk of drowsiness, less risk of falls, and a quicker return to normal bowel function, and less risk of addiction, obviously, period. So we also use aromatherapy and music therapy as indicated and as desired by the patient. Throughout the preoperative and postoperative period, we also recommend sequential compression devices to decrease the risk of blood clots developing in the legs or go into the lungs. Those are called pulmonary embolus. Using these methods helps the patient to be more alert and more able to return to normal body functions. That includes early feeding and early ambulation. Often I advise the patient to chew on some gum within a couple hours after surgery, just to get the gastric juices flowing again, and we advocate for early feeding and advancing the diet soon after surgery, starting with liquids and then advancing to solids. Also, the ability to ambulate and walk as soon as possible after surgery helps decrease the risk of blood clots in the legs or in the lungs, and also helps the patient take deeper breaths so that she may decrease the risk of pulmonary collapse or pulmonary infection, and it helps the patient feel better and return to normal body functions sooner. I've been doing this since 2003, and using those methods we have developed over time helps our patients to return to normal activity sooner and to have a quicker recovery and to have a less uncomfortable experience after undergoing surgery. At Michigan Women's Care, we have been practicing and providing excellence in gynecology, obstetrics, and women's health since 2003. We practice out of a beautiful, quiet, serene, and private office in Canton, Michigan. If you have any questions or would like a consultation with one of our doctors, please call 734-981-8181 or reach us on the web at www.michiganwomenscare.com. Thank you, and we look forward to you having continued health and well-being.